Hello friends, I welcome you in this video, and today we are going to discuss on the topic Fibrinolytics. Before starting, I request to please subscribe the channel, like, comment and share. And also don't forget to press the bell icon so that as soon as the video is released, you will get the automatic notification. Now start with Fibrinolytics. As the name indicates, it is made up of two words, fibrin and lysis. It means we are talking about the drugs which are responsible for lysis or cutting down of fibrin. Now what is fibrin? Fibrin, it is related to clot. So first we will understand what the clot is and how it is related to fibrinolytics. Our story starts with the homeostasis. What is homeostasis? We know very well. It is self-regulated mechanism of the body, and the example one of which is clotting of blood. Means whenever injury is there, the body adapts itself in order to prevent the further loss of blood. There is clotting. So as per homeostasis, the example is clotting of blood and clot formation is there. Now why blood loss is there? Because of injury. Why blood clotting need has arisen? Because of injury. This injury can be external and this injury can be internal. We are talking about internal injury. Therefore, the clot formation or the clotting of blood may be external and may be internal. As I have told, we are concerned with the internal clot formation. So to understand this, we have taken an example here. This is a diagram of blood vessel. The blood is flowing. Now, due to internal injury and in order to prevent the loss of blood, the body, as per the homeostasis, it prevents the further loss of blood and there is formation of a clot. You know very well. Now, after the formation of clot, the blood cannot flow easily. It means resistance is offered, or we can say that this is occluded blood vessel. But you will say, sir, we haven't seen such condition. This condition arises when the age progresses. Means in old age, after crossing the 45 or 50 years of age, this condition arises. So when injury is there, a clot is there, in normal individual, when no disease is there, this clot is dissolved. And how it is dissolved? It is removed by fibrinolysis. The clot is made of fibrin, and this fibrin is removed by a process that is termed as fibrinolysis. Now, if this clot is not dissolved, if it is stationary, it remains there, then that condition, this clot is termed as thrombus or thrombi. And the process of formation of thrombi or thrombus is termed as thrombosis. Now what will happen when this clot will detach from your cell? If this clot is detached from the surface and it becomes in circulation, it is termed as emboli. Means we can say that circulating thrombus is termed as emboli, and this process of formation of emboli is termed as embolism. Now the two things are clear. What is thrombosis and what is embolism? This thrombosis and embolism, these are very dangerous. Why because dangerous? Because it was a barrier here. Now if this barrier, it will reach to the fine arteries, into the coronary arteries or the peripheral arteries, they can reach there and they can completely occlude the blood vessel, due to which there will less supply of oxygen and tissue will die. And further complication can arise which can be life-threatening and patient can die. Let us see what kind of different complications are there. We have taken only the important ones. Now, this thrombosis or this clot, if it is present in coronary artery means the artery which supplies blood to the heart. So if this thrombosis in coronary artery, it can result in complication that is called myocardial infarction. Why? Because infarct will be there. And what is infarct? Suppose this blood vessel and this is the clot. Means if the complete barrier is there, complete occlusion is there, that condition is termed as infarct, and because it is in myocardium, it is called myocardium infarction. What will happen? Blood will not be able to flow, it will not be able to reach in this area, means no oxygen, means tissue will die after some time, and in that case the myocardium will not be able to contract as per the need. So this was the first complication, myocardial infarction. Now ischemia or ischemia. What happens in this? Occlusion is there, but it is partial. Means still blood can flow, but not fully, and it is called ischemia. It can result in a disease complication, that is ischemic stroke. So two complications related to this. Now third, deep vein thrombosis. The veins which are present in legs, pelvis, shoulder, there this thrombus can reach and it can cause deep vein thrombosis. Now fourth complication, if this thrombus it is there in peripheral artery, it can cause occlusion of that particular artery, and it is called peripheral artery occlusion. So this is how the thrombus is responsible for causing complication. Now we will discuss about the embolism. If this emboli reaches to the lungs, it will cause pulmonary embolism. Now all these complications are due to intravascular clot. This is intravascular clot, and therefore we can say that this intravascular clot is dangerous. Why dangerous? Because of these complications. This can occur, and this can occur. The patient can die. Therefore, this intravascular clot should be removed or should be lysed, because it is life-threatening, and if it is not treated, it can result in the death. So what should be done? Therefore, fibrinolytics should be used. Why fibrinolytics should be used? Because this intravascular clot, it is made of fibrin. Therefore, fibrinolytics should be used. And we can give the definition. The fibrinolytics are the drugs which cause fibrinolytics are the drugs which cause lysis of the fibrin, which dissolve the intravascular clot, and they are used in different diseases like myocardial infarction, ischemic stroke, deep vein thrombosis, peripheral artery occlusion, and pulmonary embolism. Now, how it is done? So, to understand, let us see this concept. See, we are talking about this fibrin. This fibrin should be dissolved. Now, how it is dissolved? It is dissolved by a substance called plasmin, which is also termed as fibrinolysin. This fibrinolysin, when acts on fibrin, which was insoluble, but due to action, it is converted into fibrin having fragments, pieces, and soluble. It means if this plasmin acts on this, it will break down into pieces, it will be removed, and it will be clear. Now, from where this plasmin comes from? It comes from another substance, that is plasminogen. Ogen means when we know it is inactive form of enzyme, for example pepsinogen, trypsinogen. So this is plasminogen. So plasminogen is an inactive. It is converted into plasmin. This plasmin acts on fibrin, which is converted into soluble form. Now, how it is converted? It is converted by substances. These are called activators. And now, what are activators? For that, you have to remember one sentence. This clot is very dangerous. तो क्या है, हर सूरत में फाइब्रिन घुलना चाहिए. At any cost, this fibrin should be dissolved. This condition, sometimes we use the synonym surat. तो SURAT हर सूरत में फाइब्रिन घुलना चाहिए। तो सूरत SURAT, S सेप्टोकाइनेज, U यूरोकाइनेज, R रेटेप्लेस, A alteplase, T tetraplase. So when these drugs are given, they act as activators. They convert plasminogen into plasmin. This plasmin acts on fibrin and converts into soluble form. It means this clot will be dissolved. So this was the story up to here. Now we will see individually, one by one, these activators. What are these? And we will see the description of them. Once again, we will see how this clot is dissolved. So this is the blood vessel, this is the clot, and this plasminogen is converted into plasmin. This plasmin is responsible for lysis of fibrin, which is converted into soluble fragments. This plasminogen is activated and converted into plasmin. This plasmin, it converts this clot into degraded products which are soluble. Now, how this plasmin is activated? It is activated by activators, and we have seen these are the examples of activators. But sir, these are the drugs. What happens in the body? In the body, the role of activators is played by TPA. TPA means tissue plasminogen activator. It is a substance which is released from the endothelium of blood vessel. After it is released, it bonds with the plasminogen. This is the plasminogen. This plasminogen, it occurs in two forms. First, it is bound to fibrin. It is bound to fibrin. And second, it remains in the circulation. So this tissue plasminogen activator, it binds to both. It binds to this also, and it binds to the plasminogen which is in circulation. Now, this tissue plasminogen activator, it is responsible for activation because itself the name is activator, plasminogen activator. So definitely it has to activate the plasminogen, and this is how the story goes. Now there is one thing. This plasmin, if it is not controlled, it will keep on lysing the other clots. So there is a check as per the homeostasis of the body. The extra plasmin or the plasmin which is not needed, it is degraded by plasmin inhibitors, which are also termed as antiplasmins. So what we are doing is we are activating this to break the clot, to lyse the clot. So this was the inside story of our body. Let us discuss these drugs one by one. First we will take Surat. We have seen S means streptokinase. In short, we have taken SK. Now we will see the different characteristics and story related to streptokinase. It is the first drug developed used as fibrinolytics, having T-half of 30 to 80 minutes. The very important thing which you have to note is it is an antigen. Remember, it is not an enzyme, it is an antigen which is obtained from beta hemolytic streptococci group C microorganism. What is this? As the name indicates, strepto means chain, microbes are arranged, and cocci matlab spherical. So means these are specific group of microorganisms which are arranged like this, and when they are grown in sheep blood agar media, how they look? There is a zone of hemolysis, and therefore because of presence of this zone, they are termed as hemolytic streptococci group C. We are not going in the details of this. Now, it is an antigen obtained from this. This streptokinase itself is inactive, but it binds with plasminogen. There is formation of activator complex which causes increased plasmin, and we know what is plasmin. It is responsible for lysis of clot. So the drug, it binds with the plasminogen, it activates plasmin, and this is the result. This is the plasminogen, drug will bind this formation, and this is the resultant. Now our drug is, what it is doing, it is acting as activator. Streptokinase is acting as activator. Now another thing, it is non-selective. We have seen plasminogen occurs in two forms, circulating and bound to fibrin. So this streptokinase, it binds not only with bound but it also binds with circulating plasminogen as well. Means if there is formation of activator complex with circulating plasminogen also, and there is increased plasmin. More plasmin will be there due to both processes, and due to this there is tendency of bleeding or hemorrhage, and this is the biggest disadvantage of streptokinase. Now next thing, now we will discuss the disadvantages one by one. As we have seen, there is increased formation of plasmin, bleeding is there. We have just seen. Now we will see the second disadvantage. Because it is an antigen, and we know what antigen is, high molecular weight substances which enter into the body and leads to development of antibodies, and also antigen are responsible for causing hypersensitivity reactions, allergic reactions, and anaphylactic reactions. Similarly, because streptokinase, it is an antigen, it can cause hypersensitivity and anaphylactic reaction in 1 to 2% of patients. Next disadvantage, there is requirement of loading dose in case of past infection. What does it mean? We are talking about streptokinase, which is obtained from Streptococci group C. It is a bacteria. It means if the patient who has been already infected in the past with this bacteria, definitely we can see the presence of antibodies against this bacteria. Now what we are doing? Now we are administering this antigen from the similar bacteria from which the patient has already infected. So what will happen? As soon as this streptokinase will be given, few dose or a small amount of dose will be neutralized. Means if 100 molecules of streptokinase are given, definitely a little amount will be neutralized, means that drug will go waste. Therefore, there is requirement of loading dose in case of past infection to neutralize the antibodies which have been already formed in the past infection. I think you have got the point. Next disadvantage, it can't be used second time due to antibodies which are formed earlier. Yes, when antigen enters, there is development of antibodies. First, if it is given, streptokinase will work, but it will not work for second time, because when it was given for the first time, antibodies has been already developed, and if it is given for second time, it will be neutralized and streptokinase will not work. So these are the disadvantages, and because of this, it is not used nowadays. The research carried on, and the new product form, that is termed as Eurokinase. This Eurokinase having a T-half of 10 to 15 minutes. It is an enzyme. It was not enzyme. It is an enzyme. It is commercially obtained from cultured human kidney cell by the tissue culture process. It was antigenic. It is non-antigenic. And when it is used in patients which have already taken streptokinase. It means when we want to use for a second time, because we know it cannot be used second time, in those cases Eurokinase is the use. It means it has all the advantages over streptokinase. This was the second fibrinolytic. Now we will see alteplase. Another name of alteplase is RTPA. RT means recombinant technology, PA means plasminogen activator. So full form is recombinant technology plasminogen activator. Now what is recombinant technology? It is a sophisticated method or a tool which is used for expressing the desired characteristics in the coming generation. It is a part of technology, it is a part of biotechnology. We are not going in the details. We are just concerned with alteplase. We will deal in the different videos. This is obtained or it is found by RT-DNA technology from human tissue culture. It is moderate specific for bound plasminogen and has less effect on circulating plasminogen. Means when it is given, more effect will be on bound plasminogen rather on circulating. So it is an advantage for us. T half is 4 to 8 minutes. Therefore, it is given by slow infusion along with co-administration of heparin so that it can work for longer time and inactivated slowly. Now let us see what are the other drugs in fibrinolytics. Next drug is retaplase. The characteristic of retaplase is it is a modified recombinant tissue RTPA, recombinant tissue plasma activator, and it is long acting. Next drug, see we are discussing SURAT like that. So retaplase is over. Now we will see the T, tenecteplase. Now this tenecteplase, the characteristics of this are it is RTPA plus it is having high fibrin selectivity, which is the desirable characteristic the fibrinolytic should have. Apart from that, it has long duration of action, and because of this it makes it superior in comparison to another fibrinolytics. It is the only fibrinolytic drug that can be taken as IV bolus, 10 seconds, 10 TEN 10. Perhaps it is just to remember that in 10 seconds it can be taken as like this. And because of this, it can be used in fibrinolytic therapy in STEMI. What is STEMI? It is one of a dangerous or a major kind of heart attack in which there is almost complete blockade in the arteries which carries oxygen and nutrients to the heart or myocardium. So this tenecteplase, this can be used because of this in this STEMI, and it can be used during the transit time or during the time when the patient reaches from home to hospital or from a certain place to the hospital. Now one more thing is there related to fibrinolytics. These are not used prophylactically, these are used therapeutically, means fibrinolytics have therapeutic use. Why? Because it works after formation of this. So this is how we have completed the fibrinolytic agents. We will keep on meeting like this. We will making everything easy like this. And for that, to meet again, please subscribe the channel, like, comment and share. Best of luck.